When you think about global health nonprofits, what organizations do you think of? Save the Children, Doctors Without Borders, Partners in Health? I did a quick Google search with the keywords global health nonprofit, and this is what came up. In the number 1 position, we have PATH, number 2, Partners in Health, and number 3, Project Hope. Then I saw Feed the Children, there's Doctors Without Borders, and Mercy Ships. Now, these are all organizations that are definitely changing the game in global health all around the world. But what I want to do in today's episode is give some smaller and newer organizations some time to shine. My name is Hethel Bauman, and this is the Global Health Pursuit. Hey, and welcome back to the podcast. I've been thinking about doing an episode like this for a while, and I thought, why not do this as my birthday episode? Yes, the date that this episode releases, September 5th, 2023, is the date of my 32nd birthday. I can't believe I'm officially deep into my early 30s. Honestly, does not feel real, but here I am. If you want to hear about some life updates, make sure to listen to the end of this episode. Now, if this is the first time you're listening in, I want to say welcome. Thank you for listening. On this podcast, one of my goals is to elevate nonprofits and individuals who are doing amazing work to help people around the world live better and more healthy lives. So, on today's episode, I'm going to call out 3 powerful women-led nonprofits that are doing life-saving, life-changing work within the global health sector. So let's dive right in. And by the way, these are in no particular order. Number 1, Jb Dondolo, run by founder, president, and CEO Lumbie Mlambo. I met Lumbie 2 years ago when I first started taking a real deep dive into the world of podcasting and the world of global health. I remember her being such a profound speaker and just incredibly passionate and humble. Jb Dondolo is a nonprofit that she started in honor of her father, who was an orphan, a farmer, and a humanitarian advocate. And as a nonprofit, Jb Dondolo's mission is to remove the barriers of access to clean water, sanitation, and hygiene within underserved and impoverished communities. But what's so incredibly beautiful about this nonprofit is that it was created out of a listening ear. Lumbie told me that in the very beginning, she had thought that the community she was serving needed a health clinic. But in reality, what they actually needed was access to clean water. So what she did was pivot everything she was doing and decided to learn what it actually takes to bring clean water to rural communities in places like Zimbabwe. I interviewed her on episode number 12 of this podcast, and I have to say, I never knew just how much work it takes just to find clean, safe, potable water. The testing you have to do, the labor you need to pay for, and just the amount of sheer willpower you need. This isn't just digging a hole in the ground and pumping out water. There's so much more that goes into this effort, and she explained everything. Now, Jb Dondolo isn't just a clean water and sanitation organization. It's an organization that aims to uplift women and girls. She shines a light on women's issues all around the world, how women are the backbone of society, how they're the ones getting up early in the morning to walk miles and miles to fetch clean water. It's so clear how her passion shines through. So if you have a passion to uplift women and girls while helping to deliver clean water, hygiene, and sanitation to rural last-mile communities, make a donation to Jb Dondolo, show your support, or get in touch with Lumbie. She's absolutely amazing. Again, go listen to episode number 12 to learn more. A link is in the description and the show notes. Moving on to number 2, World Telehealth Initiative, run by founder and CEO Sharon Allen. When I think of Sharon, I think of a woman who lets nothing come in her way. Like Lumbie, I met her a couple years ago when World Telehealth Initiative was still getting on its feet. Sharon had shared with me that she had absolutely no experience in the world of healthcare, let alone global health. Her career before World Telehealth Initiative was within the irrigation and landscaping industry. Like what? How do you go from irrigation and landscaping to global health? Her story truly inspires me, and it honestly tells me that you can really do whatever you want to do. She changed her career into something completely different just because she saw a need and she felt pulled. World Telehealth Initiative is one of the most innovative organizations that I've ever come across. It takes telehealth technology and globalized it in a way to serve rural communities around the world. With one machine, a doctor in a rural village in India could call up an expert doctor to ask for their advice, treatment plans, and collaborate on cases together. This way, patients, no matter where they live, can get access to world-class medical care just as long as there's an adequate power supply and Wi-Fi access. From cardiology to obstetrics to lung transplantation, WTI has a wide range of experts on call to serve patients around the world. If this isn't democratizing healthcare, I don't know what is. Sharon was also featured on the podcast just a couple episodes ago, so look for episode number 23, Providing Essential Healthcare Through Telehealth. It's for you if you're into tech and how it can be used for good worldwide. Get involved. And last but not least, number 3, the World Legacies Project, run by Executive Director and Founder Susan Hammond. I was introduced to Susan not too long ago by a friend of mine. Her story and her mission blew me away instantly. Susan is the daughter of a Vietnam War veteran, and in speaking with her, I realized how much information I didn't retain in my 8th grade social studies class. I think at that age, I didn't really appreciate how important history was and is. Susan created the War Legacies Project because she needed the world to know that there are still people out there that are dealing with the aftermath of the war between the US and Vietnam. Yes, we know that the war ended decades ago, but what I didn't realize was that when the US sprayed 12 million gallons of dioxin-contaminated Agent Orange, in addition to 8 million gallons of other herbicides on Vietnam, Laos, and Cambodia, with the goal of destroying jungle canopies and vegetation, this left the people of these countries, as well as US soldiers, at risk for health complications that they had not seen coming. This includes numerous types of cancers, reproductive disorders, and birth defects. Agent Orange can still be found in the soil in parts of these countries, and efforts are continued to be made to clear the chemical out to prevent future damage. The War Legacies not only advocates for further reconciliation efforts between the US and Vietnam, but it also supports those who have been affected by Agent Orange by financing medical operations for children who have been born with congenital and birth disorders stemming from Agent Orange. They also support education for children with disabilities and so much more. The work that Susan is doing is important because it forces us to reflect on the mistakes of our past so we don't repeat it in the future. So make sure to subscribe and follow the podcast because an episode with Susan about War Legacies is coming out soon, so you don't want to miss it. Check out the show notes for links and for more information. Okay, so these are 3 nonprofits that you might not find while searching the web for organizations to support. They may not get millions or hundreds of thousands of dollars in donations, but honestly, they should. That's why I wanted to share this with you. Not only are they doing the most life-saving work and advocacy, but they are being led by powerful women. And I am just all about that. And if you feel called to, go ahead and share this episode to spread the word about these nonprofits and amazing women. Oh, and make sure to leave a review for the Global Health Pursuit podcast. You can call it your birthday gift to me. Oh, hello. I see you're still here. Thank you for sticking around. As I mentioned earlier in the episode, the release date of this episode, today, September 5th, 2023, is my birthday. I'm turning 32, and all I can say is that this past year has been nothing short of eye-opening with new challenges and new experiences and just full of blessings and new connections. It was tough, though. 1 year ago, I could probably say that I was very confused on where I wanted my life to go. I did know that I had a passion in global health, but I didn't have an educational background on it. And I didn't quite know if I wanted to go back to school either. And I'm realizing that today, September 1st, as I'm recording this, that my student loans are starting to accrue interest again. So did I want to go back to school and create more loans for myself? I don't think so. All I knew was that I didn't want to go back to corporate medical devices. So I hired a career coach, Dr. Jasmine Escalera, who is amazing, by the way. She had helped me discover and rediscover what my passions were and led me back into the world of podcasting and the world of global health. So I started to explore that. And then in March of this year, I got engaged to the most amazing human. I then relaunched this podcast in April. I hired a financial coach to help me make my money work for me. Shout out to Cecilia Hernandez and her company, Wealth Healers. Go check her out. And then I tried door dashing for money. That absolutely did not work. I realized that after my last job, I really don't want to drive that much anymore. And then I stepped out of my comfort zone by starting a new job as a server at a restaurant. Yeah, I went from engineer to server. And there are some exciting new things to happen in the next couple of months that I will definitely fill you guys in on. But it's been basically 2 years since I left the corporate world, and my life has completely changed. No more rat race, no more wishing it was the weekend. Yes, anxiety is still there, but definitely not as all-consuming as it used to be. Because I think now I'm starting to feel much more aligned with my goals and my future more than ever before. And in terms of this podcast, this past month of August 2023 has been my best month yet. Only 4 months in, my downloads nearly doubled from about 450 a month to more than 800, helping me to surpass 3,000 downloads. More people are listening in, and that just drives me to create better content for you and trust the process. Good things are happening, and I want to say thank you for being on this journey with me. Let me know what's going on in your life. Shoot me a message on LinkedIn or send me an email and reach out. I'd love to connect with you. I'll see you in the next one.